Hello everyone, I'm Elisa Conticelli, University of Bologna. I'm here today, even though I'm virtually with you, to present the ENLIGHTENme project that aims to define innovative policies for improving health and well-being of citizens, addressing indoor and outdoor lighting. I would like to use our project video to introduce the main elements of our project, and then I can complement the information afterwards.
The world population is growing, urban areas are expanding, and artificial lighting is all around. Have you ever considered that this might affect your health and well-being? Our biological clock, influenced by the naturally occurring changes between light and darkness, reacts very sensitively to an inappropriate and disruptive exposure to artificial outdoor and indoor lighting. Too little of the right light during the day and too much of the wrong light at night can impact your health and well-being. Older adults over 65 years of age are particularly prone to these impacts. Genetic changes in the body and altered chemical processes exacerbate their predisposition to age-related diseases, reducing their quality of life. Lighting also disproportionately impacts older adults' lives in terms of access to public space and active participation in civic life, and through the quality of indoor spaces in which they spend more time than other age groups. This refers to the way lighting shapes urban spaces and social life, whether at home or in public spaces, thus affecting people's behaviour, moods, and sense of security, as well as social relationships. The ENLIGHTENme project has set out to mitigate these impacts by examining the correlations between health, well-being, lighting and socio-economic factors in 3 European cities, Bologna, Amsterdam and Tartu. A population-based study and qualitative fieldwork alongside co-designed public lighting installations in all 3 cities provide the insights required for new guidance and tools on cutting-edge urban lighting policies that support better public health in cities throughout Europe. ENLIGHTENme, switching on a healthier and safer future for European cities.
Okay, as you can see here and also in the video, our project is very ambitious because we want to improve health and well-being of European population, especially by working on the effects that we can measure in the elderly population, that is the most fragile in terms of effects produced by lighting, incorrect lighting on their body and their behaviors. The approach of our project is twofold because we have an approach that is based on medical studies that is integrated with a different approach that is more qualitative and sociological to better understand the effect on health, so biological features of our body, but also well-being, that is a broader concept that affects also how we experience the urban life, especially during night, and where lighting has a big role. Our approach is also characterized by not being alone. We established 3 different boards that will support our project, our activities. A more scientific advisory board that can have a say in all the scientific aspect of our project, but also 2 other different boards the board of lighting companies, so the market and lighting designer, lighting producer are represented, and the Healthy Urban Lighting Advisory Board that want to include cities, policymakers that have put lighting high in their agenda and can support us in better defining the ensuring that our outcomes can be really acceptable and understood from the market and the policymakers. As we have seen, we involved three different cities in Europe, Bologna, Amsterdam and Tartu, that are placed in different latitudes. And this is a choice that we want to consider properly, because we want to represent different situation in terms of natural and artificial lighting, but also different culture related to lighting. How the project is structured? We have foreseen three different and main phases. The knowledge building phase, that is the first phase that we have addressed, that is mostly concluded. The evidence building phase, where we want to implement different and innovative solutions, and finally the exploitation phase. Now I will very briefly present the three phases and the activities within them. The first one basically is based on the creation of a platform that we called ENLIGHTENme Atlas, that aims to collect the knowledge that is currently present in terms of urban lighting for health and well-being. So we undertaken a scoping review and we tried to geolocalize different situations, different case studies that are very relevant for setting up the state of art of the topic that we want to investigate. Again, within the Atlas, we produced also some maps. We collected data from the three cities for mapping relevant indicators concerning socio-economic, urban and lighting and health domains. And by summing up these indicators, we produced the so-called vulnerability maps that want to identify the most deprived and sensible districts that we want then analyze more in detail. Indeed, after this mapping, we were able to select one pilot district in each city where to identify a specific pilot area where to change lighting. Another data set or data that we gather are represented by satellite data, satellite images that have been collected for the three cities, try to investigate the potential of this information, this data set, for better understanding the correlation of lighting, especially lighting pollution, and the effects on our health and well-being. After the first phase of the project, the knowledge building phase, now we are in the evidence building phase, really in the middle of this very important phase of our project, that is aimed at designing and implementing lighting intervention, both indoor and outdoor lighting intervention. The first activity that we performed is the creation of the so-called urban lighting lab, so the open environment where people are engaged, local residents of the pilot area, to generate data, to give us feedbacks on their expectation, their behavior in using the urban environment, the urban space, and their preferences in terms of lighting, for really have a good experience of this space that they wish to use, to frequent, and so on. Basically, with this engagement, we were able to launch a co-design phase. So a design phase made together with local people to define the main elements of the outdoor lighting in the pilot area. Here I put an example that is the pilot area in Bologna, that I know better than the other pilot areas. Basically is a square very used by local residents, embraced by a portico and street, where the situation in terms of lighting was not nice, as you can see, different color temperature, a glare that is very annoying, and therefore the work to be done was very big. As I said, the first tasks within the urban lighting labs were the engagement, the identification of the stakeholders to engage in this co-creation process, and their engagement through different approaches, different methods, for example, observations, interview, night walks, workshops. And all these activities have been put together in a sort of roadmap for better identifying the co-creation process that from the first investigation lead to the definition of first ideas in terms of lighting, the final design, and then the implementation. Now we are in the phase where all the solutions have been implemented in the 3 cities, and now we are ready for the second phase of this evidence building phase that is devoted to play with the light. Here you can see the situation before and after the intervention, so very improved, I have to say. The portico that was horrible at the beginning, now it's really improved. As I said, we want to play with lighting, therefore we set up a smart control system that has been designed by Neri, our company, in the project, that basically allow us to change lighting according to the expectation, the perception that local inhabitant can have. So we want to understand which is the range of parameters, lighting parameters, that we can take into account to consider the urban lighting that we have set up a good lighting for them. I have spoken about outdoor lighting mainly, but again we are also working on indoor lighting. That is mainly addressed by adopting the second important approach, so the medical one. We have started a population-based study to better understand the effects of lighting on biological parameters of individuals. So this study is really focused only on elderly people, so a group of 500 people in each city is going to be recruited. We are at the final phase of this recruitment, and this big group will be divided into two different groups: an intervention group that will be equipped with a lamp that can set a controlled lighting levels that are good, positive for our biological clock and all the parameters that can allow us to stay better, I can say. While the control group will not be exposed to this good lighting, and the aim is to compare these two groups and see which effects this exposition has produced. These people, recruited people, is recruited in the pilot district, so to have the possibility to sum up the effects of indoor and outdoor lighting. Finally, I can conclude my speech by giving you a flavor of what we want to develop in terms of exploitation tools that aim to bring our results and outcome into the decision-making process, especially to influence lighting policies and design. For this purpose, we are going to develop lighting policies and guidelines for better addressing this aim and a decision support system. Few words on these two tools. Basically, the guidelines would like to give result to evidences that we have collected in our project, all the results that we obtained, and present to the general public, especially policymakers and technicians dealing with the definition of policies, strategies, and the project on lighting. So basically those that somehow has a role in producing a master plan, a lighting design project. We want to address those people and give them a very clear set of messages and recommendation on how to better design and define lighting policies that are more respectful of health and well-being. The operationalization of this guideline will be the decision support system, so a tool that can support step by step these target people to define good policies and strategies for lighting in our cities. In this final phase, the involvement of our two boards is fundamental to really produce something that is acceptable and understandable from the market and the cities. The last two output that I would like to highlight is the Health City Manager training program. That is a training that wants to address personnel from working in local administration, municipalities, but also bodies that deal with the topic of our project. The idea is to train and to define an expert that is transversal to different sectors in local administration, that is an expert on health-related topics, and urban lighting could be one topic that can be considered by the expert, and the idea is to try to break down the silos that is frequently present in our decision-making process. The other tool is the awareness-raising campaign, so targeting citizens and general public, where we want to collect key messages, especially for the indoor lighting, that can be presented and support these people to have different behaviors in terms of using lighting in their homes, so giving tips to change something that is more suitable for improving their health and well-being. I have concluded my speech. I really hope that I was clear enough. I'm not there for replying to your questions, if any, but you can see here my contact and the contacts of our project. So please, if you have any question or curiosity, don't hesitate to contact us and to follow our activities. Thank you again for your attention, and have a nice day. Bye.